Murat Jacob Kevorkian. In 1952, Kevorkian, who was from Pontiac in the state of Michigan, received his medical degree from the University of Michigan Medical School. He completed his residency in anatomical and clinical pathology. Over several decades, he expressed controversial views on death and capital punishment. In a 1959 paper, he proposed that prisoners sentenced to death could, instead of traditional execution, take part in medical experiments under full anesthesia at a scheduled time. After facing opposition from senior physicians at the University of Michigan, Kevorkian eventually decided to leave the university rather than abandon his ideas. In 1987, he placed advertisements in Detroit newspapers and introduced himself as a consultant for death counseling. He had designed a device that allowed a person, once connected to it, to press a button that released specific drugs into the body. In some cases, he also used a gas mask. His first public-assisted death involved Janet Atkins, a 54-year-old woman with Alzheimer's disease, carried out in 1990. Ultimately, the state of Michigan revoked his medical license and stated that he was no longer allowed to practice medicine or work with patients. According to his lawyer, between 1990 and 1998, he was involved in the end-of-life process of about 130 terminal patients, with the patients themselves performing the final action in all cases. Investigations showed that around 52 of the individuals who died with his assistance were not terminally ill, and at least 13 had no complaints of pain. His consultations were often extremely short, with at least 19 people dying within 24 hours of their first meeting with him. In at least 19 cases, no psychiatric evaluation was performed, and 5 of these individuals had a history of depression. In 17 cases, patients suffering from chronic pain were not referred to pain specialists, and in some instances, their medical histories were not fully reviewed. In at least 3 cases, autopsies revealed no physical signs of illness. In one case, a patient had been incorrectly diagnosed with multiple sclerosis. In another, he had not spoken directly with the first patient himself, and had only communicated with the patient's spouse. During judicial reviews, it was argued that he did not always spend enough time assessing patients' mental state or ensuring fully informed decision-making. Studies also indicated that many of those who sought his assistance, although suffering from serious and progressive conditions, were not necessarily terminally ill. 5 individuals showed no physical signs of disease, and only about 1/3 were suffering from pain. Some were dealing with psychological conditions such as depression or severe anxiety. Between May 1994 and June 1997, he was tried 4 times in connection with assisted death cases. In one case, he presented a video in court showing that after the patient gave informed consent, he personally administered the lethal drug. This marked a difference from earlier cases, where patients initiated the process themselves, whereas in this instance, he directly carried out the injection. He presented this video in court as evidence, effectively acknowledging and defending his actions. On November 25, 1998, he was charged with first-degree murder and distribution of a controlled substance. Since his medical license had been revoked 8 years earlier, he was not legally allowed to possess or use the drug. He was sent to Lakeland Correctional Facility in Michigan. After serving 8 years and 2.5 months, he was released on June 1, 2007 for good behavior. Years later, on May 18, 2011, he was hospitalized due to kidney problems and pneumonia, and his condition rapidly worsened. In the end, he developed thrombosis, and he died on June 3, 2011 in Royal Oak, Michigan. Michael Swango. During his time as a medical student at SIU School of Medicine, Swango showed unusual behavior, including an unusual interest in dying patients. Years later, it was revealed that many of the patients under his care had suddenly become critically ill, and at least 5 of them had died. At the time, no one seriously suspected him. A few years later, while he was working at Rhodes Hall at OSU, patients who appeared stable would suddenly and without clear reason die. Each time such deaths occurred, Swango was the intern on that unit. One nurse even saw him inject a substance into a patient, who became seriously ill shortly afterward. Despite multiple reports, hospital administrators did not take the consent seriously and assumed the nurses were being overly suspicious. With repeated complaints, internal investigations were superficial, and he was cleared of wrongdoing. However, his unusual behavior continued, and eventually his residency program was terminated, effectively removing him from the hospital. In July 1984, he returned to Quincy and worked in emergency medical services. But soon after, the same incidents began again. His co-workers said that whenever Swango brought food for his colleagues, several people would become seriously ill afterward. In October of that year, when arsenic and other toxic substances were discovered among his belongings, he was arrested by Quincy police. The main substance he used to poison his co-workers was a dangerous industrial chemical. In 1985, he was convicted of poisoning his co-workers and sentenced to 5 years in prison. After his release, he worked again under a new identity and entered a romantic relationship with a nurse named Kristen Kinney. During the relationship, Kinney suffered from severe headaches and recurring illnesses. When she ended the relationship, her condition improved. However, 4 months later, she died, and tests showed arsenic in her body. In 1991, Swango legally changed his name to Daniel J. Adams and re-entered the medical system using forged documents. He managed to gain the trust of those around him for a time, but after the American Medical Association learned about his past, he was fired. He continued working in other hospitals, where suspicious patient deaths occurred again. Later, the FBI tracked him down in Atlanta, where he was working as a chemist. After his lies in employment documents were discovered, he was fired and left the United States to avoid the FBI investigation. In 1994, he went to Zimbabwe and worked in a hospital using forged documents. But soon, suspicious deaths began again, and he was removed from his position due to the hospital administrator's suspicions. During that period, a woman who rented him a room became seriously ill after eating a meal with him, and it was later confirmed that she had been poisoned with arsenic. With reports and evidence gathered from several countries, the FBI concluded that Swango was likely a serial killer. In 1997, while at Chicago airport on his way to Saudi Arabia, he was arrested. He later confessed to multiple crimes, including murder and fraud, and was sentenced to 3 life terms, without the possibility of parole. Today, Swango is serving his sentence at the Supermax prison ADX Florence. Walter Freeman. Freeman entered Yale University in 1912 and graduated in 1916. After completing his studies, he moved to Washington, D.C. in 1924, where he began working as one of the first neurologists in the city. On November 12, 1935, a new surgical approach for treating mental illnesses was introduced, known as lobotomy, which focused on altering parts of the frontal lobes of the brain. Inspired by this method, he expanded on it, and instead of removing tissue, focused on cutting or reducing the connections between different parts of the brain, naming it lobotomy. Because he was not a neurosurgeon, he collaborated with James Watts to carry out the procedure. Soon after they began, they performed dozens of operations, and by 1942, the number had reached more than 200 cases. Reports from Freeman and Watts indicated that some patients improved, some showed no change, and others worsened. Later, inspired by the technique of an Italian physician, he developed the transorbital lobotomy method, a procedure that accessed the brain through the eye socket. This technique allowed him to perform the operation without open skull surgery. In this method, a specialized instrument was inserted through the eye to affect the frontal regions of the brain. During many of these procedures, Freeman worked without wearing gloves or a mask, and the method was gradually expanded to more patients. However, in 1950, because of disagreements over continuing this approach, James Watts decided to leave Freeman. After that, he traveled across the country and, in various psychiatric hospitals, taught his method to doctors. These trainings were usually free and conducted as live demonstrations. In many cases, after the operation, patients experienced a severe decline in mental and functional abilities. Even simple tasks such as eating or using the restroom became difficult, requiring them to relearn these skills. In some cases, symptoms returned, and not all patients improved. In total, about 4,000 lobotomy operations were performed across 23 U.S. states, and it is said that this method caused the deaths of about 490 patients. Despite widespread criticism, his fame continued to grow, especially after a lobotomy was performed on Rosemary Kennedy, sister of John F. Kennedy. After the procedure, she suffered severe mental and physical damage. In the end, he retired from George Washington University at the age of 57 and opened a small clinic in California, where he continued his work. After complications from cancer surgery, he died on May 31st, 1972. Thanks for watching until the end. Make sure to like and subscribe for more videos.